assessment on my daughter Jasmine. As we know, assessments are very important in nursing practice. They help to give you an idea of the patient's health, potential treatment. It also enlightens us into what a possible indicator of what's going on with the patient. First, I'm going to take her blood pressure. I'm going to take it sitting. You just sit this way for me. 100 over 80. Can you lie down for me till you lie down? Over 80. After I get my patient's blood pressure, I would do all the vital signs so far as the temperature. I would do the temperature, the blood pressure, get the patient's weight, as well as just pretty much just look at the patient's overall appearance. When the patient walks in, I would look at the gait. So far as when I do my medical assessment, listening to the patient to get the bibliograph of the patient, I would just listen to the speech of the patient, whether it's pressure speech, whether it's slurred. When I look at the patient, the way the patient walks into my presence, I would check to see if they walk with assist. Is there any, are they shuffle gait, or, are they walking with a limp? I will also look at the patient, the way they're dressed, how they dress, are they well groomed? I would look at the weight, are they losing weight, are they gaining weight? So I would pretty much just observe the patient. Also, I would go into the history of the patient, asking about past medical history, dealing with parents, history about their pretty much social life. I would just pretty much get a general overall, which would give me an idea of what to look for when I'm examining my patient. First thing I would do with my patient, I would assess their hair. I would excuse that for me. I would assess her hair just to check her scalp, see if there's any type of abrasions. I would look at the hair for pretty much if it's dry, if it's brittle. That would kind of give me an indication of what's going on with the patient so far as the patient's health is concerned. After I look at the patient's, observe the hair, I look at the patient's face. I'm looking for symmetry, making sure there's no facial droops or any type of other abnormalities with the face. I would look at the eyes, the nose, making sure that looking at the overall skin, it should be whatever whatever the patient's origin is, pretty much. I look at the patient. It's kind of bright, so the lighting should be off. But I would first assess her pupil dilations, taking and just making sure I'm checking for light accommodations, and I would check to see the dilation of the pupils. And I was also look at the sclera of the eyes. That's a good indicator. I know with depending on the patient's origin, it may be slightly not white, but kind of brownish color. It may not be totally white, and that's related because of the patient's origin. I was also note her eyes to make sure there's no type of puffiness, redness, any type of swelling, anything that would potentially lead me to think that she may have some type of infection in her eyes, like conjunctivitis, where the sclera is red and it would be running. After I look at my patient's eyes, I would look at her face just to check her nose as well, to make sure I'm just going to put my finger just below, check for patency of the nostrils. I would take the otoscope with the little point and just look up her nose to check for patency as well. I would also palpate her sinuses, making sure she doesn't feel any type of pressure in her face. As I move from her sinuses, I would also take a look in her ears as well. When you look in adults' ears, you usually pull them up. For children, it's down. So I would take the otoscope and look into her ears. I'm checking to, when I look inside the ears, it's should be like a grayish color. I will look into both ears. Before I actually assessed her ears, before I would actually examine her ears, I would look at her ears to make sure they weren't infected, they weren't red, there wasn't any type of, the skin was maintained skin integrity. I would check just the general overall ear before I actually examine her ear. Going down, I would also look at her neck. I'll look the symmetry of the neck. Can you turn towards the left? I would check to see her lymph nodes. I'm checking to see if there's any type of swelling or in her neck, any lumps, anything that would indicate is that there was some type of infection going on. I would palpate just her lymph node to see if they were swelling. When I'm assessing her neck, I would look at her thyroid as well, checking to see if she has a goiter, is there any type of bulging in the neck. So I'm going to palpate the neck. No, I feel no type of swelling or anything that's protruding outward. After I would examine her neck, I'm going to go down to her lungs. Listen to the bronchial sounds of the neck, as well as, I'm checking for any distension in the jugular vein. Any distension sometimes indicate heart failure. So I would look, then I would also listen. Take a deep breath. Deep breath. Deep breath. Okay, lungs are clear. I'm going to percuss. Okay.
Oh.
Okay, take a deep breath for me. I'm checking for firmness, tactile firmness. So when she takes a breath in and out, it should go up. Her lungs should expand and come back to that place of origin. Okay. Okay. I'm just gonna whisper it. Just say the word for me. These are egophony sounds. You should sound. It should be like a faint muffle. Can you say E?
E.
Just say a phrase.
Phrase. Phrase.
Also check the pericardium. Cardium of the neck. Okay, I'm going to, right now, I'm going to just listen to her lungs. I'm just going to listen to her lungs and her heart. I listened to the front, I listened to the front, listened back. They were clear. Didn't hear any adventitious breath sounds. PMI is the fifth intercostal space. So I'm just going to listen to her heart. It should be like a love dove sound, S1, S2. And that's the PMI, which is the point of maximum impulse. Okay, can you lay back for me? I'm going to examine her abdomen before I actually listen to her abdomen. I'm just checking to see if there's any pulsations in the stomach. I'm just getting a general overview of her abdomen, make sure there's, like I said, any pulsations, and I will listen. Positive bell sound. And I'm going to percuss. I'm going to check to see, is there any pain when I press on your abdomen? No. It should sound like a tympanic drum, which indicates there's no fluid in the abdomen. There's a fluid shift. Also feeling for the liver, the border of the liver. It should be okay. I'm going to look at her arms. I don't see any type of edema or swelling in the extremities. Going to check her capillary refills, less than 2. Check her feet. It's no, oh my goodness. Check the pulses in her feet, palpable pulses. Oh, one more test that I forgot. When I'm doing my assessment, I don't have a lot of the insurance, so it's not really sticking with me that good. So I'm trying to do it out of my mind, which is sometimes not an easy task. But I would use a tuning fork. Tuning fork is the running test, which is the running fork you use and you hit it, and it tests the hearing by air conduction. So what I would do is put it on top of her head, and I would put it on the side of her head to see if she would hear the ringing noise, which I didn't do. Sorry. After I would assess her legs, I would check for any swelling, check her skin as well to see if there's any skin integratory issues related to any type of skin breakdown, diabetic ulcers, vascular ulcers, DTIs, deep tissue injuries on the back of the heels, ulcers, vascular ulcers. I would just check to see if there's any type of skin alterations. Once I did the skin test, can you stand up for me? Okay. Can you, can you just walk for me? Okay, and come back. Okay, like I said, okay. And I just need you, can you bend down for me? Okay. I would check her back to check to see if she had any type of scoliosis within the back area. Can you stand up for me? I also would check, can you bend to the side? Okay. Okay, bend to the other side. Okay. And can you hold your hands out in front of you? This is the round bar test. We usually give it just this. Can you just hold your hands on me? Just okay. Okay, you put your hands back down. We usually give the test when we do our stroke protocol. It kind of, when people have strokes or we suspect they have a stroke, we do something called the NIH, which is similar to this particular test. Okay, can you lay that down for me? Okay. Can you take this foot and run upside your shin, then run it back? Front and back. Okay, that was the other one. Okay. Can you hold this foot up for me? Okay. Alright. That one. Okay. Can you press against my hands like you press up against the gaze? Okay. Can you press my hands backwards? This I'm testing her muscle strength. Can you make your arms stiff? So let me press them down. Okay. Can you hold your hands over top of your head? Yeah. Okay. This is a test we can bring your hands back down. This is a test we use just to check the patient's muscle strength to make sure there is no weaknesses. Sometimes patients, when they are patients that have had a stroke or CVA, they tend to display signs of weaknesses. Sometimes it's on the left side of weakness. So she moves all her extremities very well. I didn't see any deficits of any sort. She seems well nourished. She seems within her age group. Your orientation, she's alert oriented ×4, doesn't display any signs of dementia or any times of memory. Her memory is pretty much intact. I didn't look at your. Let me see. Sorry. I would also, which I failed to do in the beginning. I'm kind of jumping around, trying to go through systems, and I'm kind of jumping around because I'm not really normally used to doing this in front of a camera. I'm usually doing it with my patients. But I would look into her mouth as well. I would assess her tonsils. Their grade is from 1 to 4. The normal range is between 1 and 2. I would also, I would also touch her cranial nerves as well. Can you look out your tongue? Okay. Can you smile? Can you frown? Can you lift your eyebrows up? Okay. I will also assess her cranial nerves as well. Also, just sit up again for me. Can you turn your head to the right and to the left? Can you turn your head? Can you bob up and down? And also, like, can you chew your a TMJ? Also, when I look into her mouth, I would check the membranes of the mouth to make sure they weren't dry. Let me see, it should be pink in color. Check in to see any cavities. Okay. Tongue, pink. Okay. When looking at her as well, I would check the skin turn. So usually take it in this, and it tells you about how well the patient is being hydrated. I would look at like the overall appearance of the skin is not dry. Pretty much her origin. I don't see any type of breakdown. Her feet seems to be no ulcers. I don't see any thing that would be from the ordinary. I'm trying to think of what I didn't cover because I'm trying to do the full assessment. And like I said, we don't on my particular unit. I work with cardiac patients, so we're pretty much just look at the heart and the rhythm of the heart, and we're kind of focused on one particular thing. I'm trying to think. I hope I didn't forget anything. Okay, this concludes my video. Thank you. Thank you for a wonderful